Hi, and welcome to the informational video series on the rules for certified family. This is video number 4, and we will cover duties and qualifications of the provider and assistants, orientation, initial and annual training, training criteria, children in care, and caregiver to child ratios, supervision, creating a healthy climate for child development, and program schedules and activities. My name is Kelly Jones. I work for the Child Care Licensing Division as a licensing specialist in the Salem unit. The Child Care Licensing Division hopes that you find these videos informative and supportive in learning about the new Certified Family Rule Set. During each video in the series, we will explain some of the key features and highlights of the Certified Family Rules. Another new aspect is that the rules have been organized differently to help make information easier to find. While we are highlighting many key features, changes, and new rules throughout this video series, the entire rule set will not be reviewed. Please refer to the Certified Family Rulebook for the full list of requirements and rules. Okay, let's get started. Next, we'll discuss the key changes to provider qualifications and substitute provider requirements under the revised Certified Family Rules. The most significant update includes the requirement for providers to now either attain a Step 6 in ORO, complete 20 semester credits in early childhood education or child development, or accumulate 1,500 hours of documented experience in a child care environment. Substitute providers must now meet Assistant 2 qualifications and maintain documentation of specific items reviewed. Additionally, Child Care Substitutes of Oregon, CCSO, substitutes now have the flexibility to serve as providers, Assistant 2, or Assistant 1 without prior experience in the program, as long as they complete an orientation beforehand. These changes aim to create a more streamlined and accessible path for childcare providers while maintaining quality standards. Recent updates to the Certified Family Rules introduce key modifications regarding Assistant 1 and Assistant 2 positions. Assistant 1 can now be 14 years old with supervision requirements defined based on age due to CBR enrollment restrictions. The supervision requirements include that if under 18, the assistant must be within sight and sound of a qualified caregiver and can never be left alone with children. If 18 or older, the Assistant 1 must be within sight or sound of a qualified caregiver while supervising children. Assistant 1s may also transition to Assistant 2 once they complete all training requirements and reach 18 years of age. The previous requirement of 60 hours of experience to become an Assistant 2 has been eliminated. The updated Assistant 2 requirements include that they must be at least 18 years of age and enrolled in the Central Background Registry, complete all orientation and initial training requirements, and meet annual training requirements. These updates provide more opportunities for individuals to enter the childcare workforce while maintaining essential training and supervision standards. Recent updates to the Certified Family Rules outline essential training and certification requirements for providers and caregivers. In addition to the other safety set trainings, Foundations for Learning training must be completed before having unsupervised access to childcare children. This is currently required. It is just now written in rule, just like Introduction to Childcare Health and Safety and Recognizing and Reporting Child Abuse and Neglect. All other safety set training requirements have stayed the same. These updates ensure that all providers and caregivers meet critical safety and training standards to maintain high-quality childcare environments. Let's review an important update regarding annual training for substitute providers and substitute assistant twos. Under this rule update, substitute providers and substitute assistant twos who work 240 hours or more during the licensing period are now required to complete annual training hours. Those meeting this threshold must fulfill the annual training requirements outlined in rule to ensure they maintain the necessary knowledge and skills for quality care. This change ensures consistency in training and maintains high standards of care across all roles. Let's now discuss some important updates related to caregiver training and the use of the Organ Registry Online, also referred to as ORO. All caregivers employed by a certified family provider must have an active account with ORO. This is the state's online system for tracking training and credentials. It ensures that all caregivers are properly registered and that their training records are up to date. Additionally, all training must be approved by ORO to count towards required certifications or qualifications. Another change is that the Recognizing and Reporting Child Abuse and Neglect, RCAN, training can now be taken every 3 years instead of every 5 years as it was previously. This adjustment helps ensure that caregivers are consistently updated on best practice and legal requirements when it comes to identifying and reporting child abuse and neglect. These changes aim to keep training consistent, up to date, and properly documented to ensure that all caregivers are qualified and prepared to provide safe and effective care for the children in your program. Let's go over some key updates to the Certified Family Rule that impact caregiver ratios and infant care requirements. The new rules only have one ratio table. The number of required caregivers is determined by the age and number of the youngest children in the group. Caregiver-to-child ratio requirements outlined in Table A must be followed at all times to ensure safe supervision. Unlike before, there is no limit on the total group size as long as caregiver-to-child ratios are maintained. If infants who are not yet crawling share an activity area with older children, you must have a written plan detailing how caregivers will ensure their safety. This plan must be implemented whenever non-crawling infants are present with older children. A provider's child under 6 weeks old may be in care without requiring an exception. However, no child younger than 6 weeks, other than the provider's own, can be in care at a certified family child care home. These updates help streamline ratio guidelines, ensure proper supervision, and promote infant safety in mixed age settings. Our next topic to review are updates to the Certified Family Rule regarding outdoor supervision and caregiver responsibilities. Whenever children under 36 months are outside, at least one caregiver must be present outdoors to ensure supervision and safety. If multiple caregivers are required to meet caregiver-to-child ratios, one caregiver may step away temporarily for tasks that support the care and education of children. These tasks may include cleaning up after an activity, preparing items for a new activity, cooking meals. The caregiver completing these tasks must still be within sight or sound of the children and able to respond if needed. However, they do not have to provide their full attention to the children while performing these supporting activities. This update helps balance active supervision with essential caregiving tasks, ensuring both safety and efficiency in the childcare setting. Some additional updates regarding supervision requirements are around napping and resting periods in certified family childcare settings. Caregivers must ensure that there is sufficient light in any room where children are napping or resting. This is important so that caregivers can clearly see each child's face from any point in the room. This helps caregivers maintain visibility and quickly assess the well-being of all the children, even if they are resting. It's also important to be mindful of background noise in rooms where children are napping. Whether you're using music, a sound machine, or white noise to help children rest, the noise must not be too loud to prevent caregivers from hearing and responding to children's needs. The caregiver's ability to respond promptly to any situation is key to maintaining safety during nap time. When a caregiver is in a separate room from the children, the doors must be kept open wide enough so that the caregiver can easily step into the room to perform frequent audio and visual checks of the children. This allows the caregiver to ensure the children are safe and comfortable, even if they are in a different space. Lastly, children may not be on a different floor level of the home unless a caregiver is on the same floor to maintain direct supervision and be able to quickly respond to children's needs. These changes reinforce child safety and active supervision during all times of care, especially during resting periods. Let's now talk about updates that focus on the ways in which caregivers communicate and interact with children to foster a positive and supportive environment. When interacting with children, you must ensure that the environment promotes healthy, culturally responsive child development. This means creating a space where children feel heard, respected, and encouraged. Some examples of this include giving encouragement and positive feedback to help build confidence, as well as modeling active listening and showing respect when communicating. Speaking to children at their eye level, which helps them feel valued and understood. Providing kind greetings and goodbyes to foster a welcoming environment. Validating children's feelings and ideas so they know their emotions are acknowledged. Using a calm and encouraging tone of voice to create a safe space. Being curious about the individuality of each child and their family to better support their unique needs. As we continue with creating a healthy climate for child development, it is important that you also encourage positive interactions between children. Some ways to support this include modeling social skills and empathy so children learn how to interact with others respectfully. Helping children understand their feelings and the feelings of others, fostering kindness and compassion. Supporting children who may struggle to make friends by guiding them and creating opportunities for connection. Encourage play between children of all abilities and backgrounds to promote inclusivity and mutual respect. Lift and move children safely. Lastly, it's important to note that when caregivers are lifting or moving a child, they must do so in a way that ensures safety and comfort for the child. This means using appropriate techniques and being mindful of the child's comfort throughout the process. By implementing these practices, children will feel respected, valued, and better equipped to navigate relationships and emotions, and helps providers foster a nurturing and supportive environment that prioritizes both the emotional and physical well-being of the children in their care. Now, let's go over the updates regarding routines and how the schedule should be structured for the children in care. One of the key changes is to the screen time guidelines. The new rule adjusts the previous daily limit from 2 hours a day to a weekly limit of 10 hours a week for school-aged children and 5 hours a week for children who are preschool age and younger. This gives more flexibility while still limiting screen time to ensure that children have a healthy balance of activities throughout the week. Another important update is that you and other caregivers must ensure daily outdoor play for each child, regardless of their age. Bearing in mind weather and environmental conditions do not pose a health or safety risk. This helps ensure that children get the physical activity and fresh air they need every day, which is important for their physical and mental development. Thank you for watching this video in our informational video series. You can now move on to the next video in this series. If you have any questions, please contact your licensing specialist. For more information, visit our website at www.oregon.gov/DELC.